me osonfoba Mary ne osonfoba Ellen odofo shiame odofo Yesu yenkwa Oma nkwa na ne mu nso na nkwa wo nanso nkwa a Yesu ede man entumi ndi dwuma bi age se ewa pomuden wenti na THM TV di dwuma di a wato din Mapomuden ebrewe dwuma di mu no ye behwe se empo ye Kristofo yi ekoba se ye kire koma kwampa ban ne befa so a ye betumi Odofo ma akwaba eba THM TV so ijumedi a watu din Mapomuden yeda Yehua Nyankopon ase Yesu Kristo a na domunti yati ase ne munyam nyina nka ne din ye ma ne din so esanse wa ma ye nkwa ama ya pomuden so nti na yete hei ena wo nso utie ana ohwe Yesu yenkwa Oma nkwa na nkwa Awurade ewenimu a osan de ma no entumi nni dwuma bi age se ye wo apomuden ti na ye nchia no se uka se Yesu mu nkwa ne age so se ihia apomuden ihre agya Nyankopon bebre wo de waye afei nso so ye de nchia kese ne nhira kese ma the chief laborer in the Lord's vineyard Apostle Moses de genu ametepe radisha no papa ewo nadom ne ne humobra onam ne mu na ono nso ama ne ho kwan a onam ne so tete na afei nso ma yakwanya nso etima na ewe ye mu nso epue radisha no ne ma dan na radisha mo papa ewo ne a radina mo so eye Ishra National Executives National Presbytery ene asafotru ni nyina wa wohwemi a wa nhwe program yi a enye program no ye di nchia kese ma wo radin shaw safia na de TV na to ha THM TV ni ijumedi a watu din Mapomuden ena wohwe fre odofo bi na ono nso fre odofo bi na kache nse emre na so ebisua de THM TV jumedi a watu din Mapomuden no asan ababio yefa akonya yi so ne aka kire se wo adwatondie bi ana se wo ade bi opese obon dawuro se yensa no dwuma bi ana se wo hospital wo adwuma ku bi na opese obon dawuro na ensoso no nya ba bi afabra ye bebon dawuro so de ba THM TV a na ye bebon dawuro ama ewo program yi so ene emre bia mpo pese ye bon bon dawuro no emawo na nsusu benya dansidie na obehunu se eyampara Onyankopon ne yen ene wo bedi ne yie obeti de ekoso no emu yie na obehunu se Onyankopon one wo edi ne yie ehranka Awurade din se watinti obeye ne saa afei ye twenwadwen asisu se ene eye eda etwato a ye beye program yi eye odwoada anwumre aba wakwan so dwoada anwumre no nan kosi nunumu bia nanso no ensesan ebem ye ka se besumi me ni mu me enso eye next week yara nti nyame bo next week ni ye be hyase me menda no anwumre nunum kosi nunsia se de yabom nka ye dada no eni nti hyene nsoma ye se de be ya edu ho a ubehwe na ahye Awurade din animunyam Mapomuden dwumadi esu yesua de bebre yesua de fa didi ahodo ho yesua de fa fasting ho yesua de fa hypertension ne ho nsɛmsɛm yesua de fa strade ahodo akuyemu yesua de bebre last week nso so Awurade Yesu Kristo adom ode apomuden mu nimdifo kese bi bedom yen oye Dr. Adwuma na che na ne rank ye principal medical officer ne de HSA wadi dwuma no ache ekonanim Awurade ye adom one ye hye adesua bi efa DM and I said diabetes mellitus so of akonya no so san kire ye bi na ade e friend insipidus kakra ene owaha eye Dr. Reginald Pacho de to aso ya na waka wate Dr. Reginald Yama Akwaba.
Thank you, Dcns Mary.
Radisha Papa, Dr. Reginald Mark Bodine.
Camilon.
Yana me pesa me boetin. Tini yana me mosono. Camilon, Dr. Reginald Camilon, yes. A principal medical officer. Ewo Eniwa Hospital. Eniwa Medical Center. And I said, your friend Emina Hospital, no. E radia domo ye juma na che. Na di suano ni esuan last week no ma ye hunu pa se ampara o tumi wodi wo kire no so. Ene e radia ya domo de na be ka ye nsa bio. Enti no ye be san akọ ne ho bio na di owode ma ye no ye tie. Eja ye mo akọ aba bio.
Thank you.
All
right. So last week we started our education on diabetes mellitus.
Okay.
And then we stated what it is. We principally stated that diabetes mellitus is a metabolic disorder as a result of high blood sugar. Yes, so we stated some reference points. We realized that there is a normal blood sugar when you have fasted for at least 8 hours. The range is 3.6 to 6.4 millimeters per liter. And then when you have eaten and we check the blood sugar, we call it the random blood sugar. And then we realize that one, the range increases from 3.6 to 11. And then, so that one, the first two that I've mentioned, fasting blood sugar, random blood sugar, it checks the blood sugar at a time. It gives us a picture of your blood sugar at the moment. Then there is what we call the glycated hemoglobin, which checks your blood sugar. It gives us an idea of what has been happening at the tissue level for a window of 2 to 3 months. Yes. And then we moved on to look at the symptoms of diabetes, and we talked about 3 classical or principal symptoms, which were polydipsia, that is to say that you feel frequent thirst and need to drink water, and this is because you experience what we call polyuria, that is frequent urination. And then there was a condition of what we call polyphagia, that is to say that you get hungry frequently, so you eat more, but this doesn't translate into weight gain. And so we stated that this diabetes is also unofficially termed or described as starvation in the midst of plenty.
Okay.
Glucose or blood sugar is what the body needs as energy. There's plenty of this glucose in your blood, but the body is not able to utilize it. So your body feels hungry, and then you are forced to eat. When you even eat, then the body is not able to even utilize it, so you keep losing weight. So we want to progress today. We mentioned that unexplained weight loss. Unexplained weight loss could be as a result of diabetes mellitus.
Is
so
that
I want you to.
Okay.
It's a top up.
It's a top up? No.
Yes.
Then
So,
and let that top up be part of today's.
all right. That's
So
fine.
your summary has ended on the starvation amidst plenty.
Yeah.
Okay. All right. Apomudimu nimdifuei. The last week, and I said, now, okay, no, dear Shasi, no, and now what bonnet tofa ewo bro for Casemu Amayeno. Now, can say, you said diabetes mellitus, no, a chese mojamu yarea, a chese a siche, I womujanimuno doors was saying, and can was a woman, and untino, if you dear, your day a share a sitrino, and I say, a de check a sitrino, senka wundi di no hearing what tria. And kaya 3.6 equals 6.4 there. Cause say a was our range in him. And into my only D and a shena sebro soa. And just a wool bang and answer would be now winning now for all my so or my twasso. I share aye and she should move a car home and not just say a show. Now, for so so what did din so and also free 3.6 na e call 11 instead of 6.4 no more we did no it just say we say omo hwe hu bibi na omo ye ho adwuma na we say de be na obe de duro so ana kwan pa e be fa so ama Mapomuden no ho ento chima pi no eno so ma ye na fe so mu se ebi wo ha ho o wasi cheyare na oba asfitia na wato ne wa fedu na wa chire kom na asesi chie ni kofom na so mu wo test bi a na meka se sisi ananse obesisi wa ho ana so ni pani be ku nso wumpom ukona ko biri o mani so a omo ntimi mbiri o mani so omo wo test from some friend glycated hemoglobin eno no ebe kire wo se ebe kire wo mo se di akoso wo moja ni mu e wo si kire kwan so anase di akoso e wo honam dia ni mu bosumi mienu ni bosumi miensa achi edi saada na anase na wotwe a wo beba na wo hwe wadi die e na wo kire kom na ba ya na wo si kire kofom a wontimi mfa mbiri mo mani so omo kwan o mbehwe afei so san koye nim kakra na yesuan ade bi ehun se diabetes ne woni ma miensa akase miensa bi e da ne ho ade ma wo hunu se wo sa yare no na de okase polyuria na che se obadwun so bebre eno no oka ho asem se ebe ma wadwun so bebre e na afen so se polydipsia isan se ujun so bebre na ho nsuo no ekọ bebre ni ntino ho na ne be ka se mami nsuo no ti be san no nsuo bebre e na afen so de to so bi mo so friend polyphagia ani edidi e boro so ubedidi bebre enya didi e boro so ye nka ne sa se ubedidi bebre nsuo no honam no ntimi mfa nya na dwuma se de pe iti asichire na betai moja nimu na nso ntimi nko honam dia ne mu mane honam dia ne mfa nya adwuma eni ti no mo ka brofu bi se starvation na miss plenty asichire no anameti asichire no doso ewo moja nimu die na nso so no eno ne plenty no na nso so honam dia na answer the cells that needs the sugar to work with it's not getting it, so the cells are starving while there's plenty of sugar in the blood. And you know, my friend, starvation and miss plenty. What did you be so could you know mojanim and conipeduanimu said ye etieno and mahonam into me emfa and tea ocasi to say so form pananka wo na wo form so so did da betimi aye say if I can see a better say oh diabetes then no so the baby air top it up na me see a better say if you tie san kon ho bio.
All right. So thank you very much. So as I stated, when there is polyphagia, it simply means that you are eating a lot, but the body is not able to utilize it because of the metabolic disorder we are talking about, diabetes mellitus. And so it can result in what we call unexplained weight loss. And this is what you notice about unexplained weight loss. If in a period of 6 months to 12 months, you notice that you have lost weight. If we are measuring, if we say that you have lost like 5% of your original weight, that is to say that you realize that you have lost weight significantly, not because you are dieting, not because you have gone on a weight loss program, but you are eating normally, doing everything you must do normally, but you keep losing weight, and when you track, it's been consistent over the period of 6 months to 12 months, you realize that you keep decreasing in weight. It's an unexplained weight loss. You have not intentionally decided to engage in certain practices, whether exercise or dieting, to lose weight. So
yet you are losing weight.
Yet you are losing weight. It could be diabetes. There are other conditions that may cause unexplained weight loss, but if you notice you're experiencing unexplained weight loss, you need to visit the hospital. You need to be evaluated. It could be diabetes mellitus. Apart from unexplained weight loss, there is what we call fatigue. I told you that the blood sugar or blood glucose is the body's main source of energy. It's just like the fuel, the petrol or diesel for a car. For the body, it is glucose. or blood sugar. Now, there's a presence of this blood sugar, but the body is not able to utilize it. So you will feel weak. You will feel lethargic. So if you are feeling chronic weakness, chronic fatigue, it could be diabetes. You need to visit the clinic. You need to complain about your symptom and let the medical personnel evaluate you. Aside that, there could be blurriness of vision. If your vision, the clarity of your vision has reduced, you need to visit the clinic to be evaluated. These days, there are plenty pharmacy shops that even do blood sugar testing. You could go and let them test your sugar and see it could be it. Where there's a clinic close by, you could go to the clinic and get evaluated. So blurriness of vision could be a pointer to diabetes mellitus. Now, if you experience that when you get a wound, it doesn't heal quickly. Ordinarily, if you get...
Can you please take it and at this pause at this end,
yeah.
as in, so the first three you have mentioned are
unexplained weight loss.
And then the second one was the fatigue, and then
easily get tired,
the side. Okay, let me reach my viewers on that. Apomuden nimdifo no achre yen se se wo ho na se oso te efri bosumi nsia kopem afimu wo hwe se wankasa se de wudidia na wudidi se de wo ye wadwuma na wo ye wadwuma on hye dan kan se wo pesa wo so tinti wo ye exercise bi ana se wudi dwuma bi a wo pesa wo so te ana se on hye dan kan se wo pesa wo so tinti no wate wadidi so ana wasesan wadidi mu na enso no bosumi nsia ana se ekosi afimu no wahu se umuduro ne so ate a eye de yehunu enye se kakra bi wuhunu significant a leke se e wo se ukọ apomuden emu ayaresabia na yehwe ne ekoso ne de ekọ de etochima wo nipadie no a ebetumi aye asichwe yawie ana se bi mpa de foforo na apomuden mu nimdefo ahwe na watimi asiesiu ama won so oho esane wo afei so oka se ni ebema wahunu se wo asichwe yawie bi ni se wo ya de a enche na wabre na botaye no de de sa de ne ba ne se sansa oka se asichwe no anase the sugar we take in no eno na te se car ni fuel no a ebi ni me ntimi nko no ntinka wo se nka wodidi no nke ko cells nim ekọ nipadie nim ahonam ne ba ye adwuma na enso akotai moja nim a moja ne ntimi fa ma honam no eni ti ne ka se moja masichiri yare no eti honam no kom de no nti wo ya de kakra na wabre. So that is the easy fatigue he was talking about. Afei so wasambo eni a ede hwade so se wo hwa to me se wonu ba bia na se enhedanye wadu ba bi kra bo se wunhuna de yie wadi hunu no aye afa ne afa ase soti afi de wo hwade age se wo de kwa chiri kakra bi se or that and okay it's eno ne sen eno na de hunu ne sen
it's like cloudiness.
Okay.
Choose a boabo in this kakra.
Okay.
And then the quality of vision, the clearness has reduced. The brightness has reduced.
Okay.
When you see things clearly, whether it's close or far, that one has to do, we call it refractive errors.
Oh, okay.
Those ones we corrected by lenses.
Okay.
So I am using a lens to correct my own. But with the blurriness of vision, whether you are wearing spectacles or not,
you still have a blurred. Oh, okay.
You will still experience it if it is there. Yes.
Okay. Thanks for the correction and the clarification. Yeah, emfa apomuden sunsanso boni biara emre. Afei so yenda ne da setena ye kwa ye bɛn ye didie mu ya setena mu kwan bɛn ne fa so a ye betimi atena se a yebeti ama Yapomuden akonkan na mpo akoba se obi wo Apomuden hu sunsanso bi anasa yare bi a metimi abobodin bi se siche yare anasa akoma yare a kwampa ben na obetumi atmase ama Yapomuden na atoa so a enku ne ntamanase emfa ne nko adamena mu entem we ene ne tete sa nyina nti ena program yi eba Jumadi ebekoso THM TV me osonfoba Mary ne de eba no enti ebekọ no hobi na wato asamaye.
Right. So another symptom of diabetes is when you realize that when you get injured, the wound doesn't heal early. Okay. So probably a simple wound that is supposed to probably heal in a week, you could go like 3 weeks before it heals. It could be a pointer to diabetes. But when there is diabetes, it impairs wound healing. So if you notice that of late, when you get injured, the wound takes long to heal, it could be a pointer to diabetes. Then when you have skin infections, if you're experiencing frequent skin infections, especially boils, frequent skin infections, especially boils, it could be a pointer to diabetes.
Why that?
Yes, so this is what happens. Diabetes is as a result of high blood sugar. Okay. The high blood sugar promotes infection. The bacteria is, we call it, they like that medium.
Becomes a comfortable zone for them.
Yes. So we have factors we call growth medium. That presence of sugar in the tissues or in the blood enhances their growth.
Okay.
Yes, because ordinarily everybody has, we call them commensals, some form of microorganisms on the skin.
Okay.
It's normal. God created us with it. But then certain...
Is that the one you call a normal flora?
Yes.
Okay.
So the presence of high blood sugar in the blood sometimes impairs the immune system a bit. And then the sugar also enhances their growth, so they will grow beyond the normal level, and that will begin to cause problems like infection. So frequent skin infections, especially boils, recurrent boils.
Okay.
Yes. Every now and then, if you experience boil once in a while, sometimes you may not even take antibiotics to resolve. But then somebody who repetitively gets a boil, you treat.
How repetitive?
So the repetitiveness is difficult to measure.
Okay.
But let's say if you can go 2 years without experiencing a boil, because a lot of people are like that, and you realize that within a particular year you have experienced boils 3 times. Okay. It's significant.
Okay.
Or within a particular year you're experiencing boils like 5 times.
Okay.
You go to the hospital, you are given medication, you take it. Then a few months after, then you experience it again. It could be a pointer to diabetes. Though there are other conditions that might cause that. Diabetes can also cause that. Even some women who experience a lot of recurrent vaginal discharge, especially recurrent vaginal candidiasis or vaginitis, it could be a pointer to diabetes. You need to be evaluated beyond just being given medication or samples being taken for histology and culture. You need to evaluate your blood sugar. It could be the presence of diabetes. If I should top up.
No, let me take this one.
Yes.
Thank you very much and God bless you.
Amen.
Therefore, Apomuden mu nindifo no Asante ka bi aka ho na yebeka akyerewo sede be na onso beti ase na wahunu ni ope akyere apoto na nsoso yede ba okase mama onso wate ase na ansa na no yepese ye kai obi o se THM TV na utie na uhwe ni dwumadi a watudin Mapomuden a eba nka eba wakwan so no nan adwoada no nan kosi no numu bia no eno na wani gu so a wo hwei na yesan kai wo se eye bosumi a yebesi ye next week ye ebe hyase akọ meme nda anwumre no nonum kosi no nsia enu ti hwe program yenim next week anase next month no hwe nanim meme nda anwumre nonum ekosi no nsia instead of no nine adwoada no nine kosi no num a ka wotie ne da bia no afei nso so no ye kai wo se wo adwatonde bi anase wo dwuma kuo bi ana wo bia pese obo hu da wura fa bedom yen fa besie yen na yen so yenye ehu advert amount anase ye mo hu da wura ma na ubedi hu adanse se wiase nyina bete wonka na ubedi hu adanse se ampara onyankopon so ehira wo papa WhatsApp line no 0264144536 WhatsApp line no wo question bi ana wo comment bi a 0264144536 betimi dia fa ho na yakenkan ahye erade animunyam na anuye bi so ho a na yama waye number no so a obefresi mu no akakakra ama ya wi a ebe ma wafre bisi yesua de nti yesel se de achi na emre kakra bi mu no ye de number no beto screen no so na afi wafre na ya toaso erade sha papa dear Mapomuden mu nim defo Dr. Reginald Ekan say Asante tutu bi se wo ho na se kuro 2 e kuro anka bi ade twa kakra anka wonim se ebedi be na wotwe bi ne kekọ na so so ekọ nani me di bosume miensa nko ya ti kuro 2 na chance na wu a eno nko a so etimi kire wo se kire wo se ebetimi aba se wanya asichiri yare afei so anase wo ho a enche na afei uhunamani no nyoma bi sisi ani titiriw pompo obo so se titiriw pompo se bia nka wo ho no ebia nka mfie mienu kora na pompo mo da na mfie pimpo na afei wo behwe se ebedi afe baako na afe baako ni mu no pompo timi bom prenu ana prensa ana mpo asensa ebetimi abase asichire na ewo umoja ni makosuru ntia ena ema mpompo no ebobo saa na mebisa na se nchiremu ode bae ni se sichire no doso ewo moja ni mu saa yewo onyankopon de mmoa wa bi egu ye nipadua ni mu dada a odi wonjuma dada obia wo saa mmoa wa ni bi na se wo asichire no edoso wo moja mu a ebema sa tnabria e ma sa mo no etena mu no eye comfortable na so omo ni je ewo mu nti no omo be dooso sen se de omo tie no aha e sense omo dooso nti na afi dia sha se eye mpompo ene honamani yarewa ewo wo honamani enu nti de be kire wa ne se titiriu tumika ko Apomuden aso ye hwehwe omo janum na ye hwehwe se sichire no broso ana yare bi aba afi so se yen mai na kakra na menya white kakra mase nioma no dooso ensu egugugu no ase dooso dodo na se ebroso se de unim no does it smell?
So we say recurrent vaginal infection.
Okay.
If we are to deal with that topic, then we'll
Osofo ba Ellen. Okay. Odofo Shiame. Na yen true enkohwe Mapomuden erade sha. Okay. Man so egu won asani o me free wom yemba mu ba enye ade a eye normal no ne dooso no na menya white wakoto aduro wo drugstore yaye eko na menya white doctor akohu doctor gynecologist wahwe no ni o kire ye ni se wo so wo se toatoa so saa wo so wo kotra na wo kohwe wo sichire mu omogya mu se sichire ne wo mu na dooso ana se sichire ne dooso a e masa amoa wa no so tena bre ne ye de e ma wo mu enti wo mu dooso a e betumi de saa yare wo friend vagina candida na se bibia no aba enso na ye sichire yare Eradi sha Dr. Papa cho yebe san akọ ho bi o.
Amen. So just to add to
Odofo
talking about
Yesu yenkwa
so
omankwa na ne mu nso na nkwa wo nanso nkwa a Yesu de man entumi ndi dwuma bi age se ewa pomuden wentina THM TV di dwuma di a wato di Mapomuden ebrewe dwuma di mu no ye behwe se empo ye Kristofo yi ekoba se ye kire koma kwampa ban na befa so a ye betumi adidi a emfa Apomuden mu sunsuanso boni biara emreye afei nso ye nda ne da setena ye kwa ye bai ye didie mu ya setena mu kwambe ne efa so a ye betumi atena se a ye betumi ama ya Apomuden akonkan na mpo akoba se obi wo Apomuden mu sunsuanso bi anase yare bi a metimi abobodin bi ti se siche yare anase akoma yare a kwampa ban na obetumi atena se ama na Apomuden na atoa so a enku ne ntema na se emfa ne nko adamena mu entem wei ene ne tete saa nyina nti na program yi eba dwumadie ebekoso THM TV me osonfoba Mary ne osonfoba Ellen odofo shiame na yentru enkohwe Mapomuden erade sha.
And then for some women they could also experience what we call vaginal dryness, which will make coitus painful for them. Then men could experience what we call erectile dysfunction.
Oh, okay.
Diabetes could cause erectile.
The disease.
Yes, erectile dysfunction. So if you're a man and you're experiencing erectile dysfunction, aside other evaluations, we need to look at your blood sugar. It could be the cause if the sugar level is high. So.
All right. So I want to find out. Yes. No, conclude. You were saying something.
All right.
Sorry.
So to state a remote pointer to a possible cause of diabetes, a skin condition, we call it acanthosis nigricans. It's usually discoloration, depending upon your skin color or your race. It may be a dark discoloration or a pale discoloration, especially at certain folds of the skin, like the neck, the joint, the armpit. For women, probably the fold in between the breast. You may see those discoloration. We call it acanthosis nigricans. It could be diabetes causing that. Because if you treat it, it may recur. But if we screen and find out it's diabetes you have developed that is causing that, once we control and manage the diabetes, it resolves.
Wow.
Yeah.
Acanthosis nigricans. We thank Doctor so much for the knowledge he's impacting on us, in us, right? Thank you so much. Thank you so much. Adofonum wacheche bi aka ho nyoma be ma afei wa hu se si hweyare wo moja ni mu no. Any say me sha se fi brofo kese no kan say acanthosis nigricans
Yes.
Any say say bi a wo ye kokoa na so tuntum no ube hu se wa matuo mu na se wo kon ase ana oba wo no fontem no enam ne die bubu tutu so no ube hu se color na sesa to which colors as in.
So it could be pale or dark.
Okay, but
then obviously you will see the discoloration there.
Oh, okay. Better I tuntum na color fufu bi na o se de be che ni se ube hunu se den a better I color bia but ube hunu se honam no de bia se de hotie na sesa color na sesa eno ne brofo kakraka no acanthosis nigricans eno no o se obesa ebia de do be yeso be kọ wenu edo bia be kọ enso be samba nti omo hu se ukona yehwe a no mo hu se siche yare na etwiche siche yare na eno so be kọ eboa yo afei so o se ema no ebi enya nsuo gugu o bebre anase ne bebre efifi o masen ebi nso ha o manase ema ne ba ni mu ye den dry awo very good I say a wire dry inti no esan say hwa awo ninti edru one niwra anase very man hia mumu ana abeye oyawo amano diabetes sense money etimi dibi no nye cancer nko awo yo yati cancer no is diabetes timi yesa yo radical doctor papa afei so se merima no nso etimi ba se siche yare no eba omoja ni ma ebitia ba se ema wontimi nya adwuma kra se berima ewo mpemu enu eye enema bi a etimi point se wonso wo siche yare have I exhausted all?
Yeah.
Okay, Pacho, you be calling chain bio na. Have you exhausted us in signs and symptoms?
So we
should
move
go.
on.
Okay, Pacho, you be say what does diabetes do to the body? Or where you dey one who say moja no muno siche na kosoro. Na abem awie no. Den wan hwe ho asem anka. Den timi de ye honam dia no. Anasa brofum you be say complications.
Yes.
What are the complications of
or dangers of diabetes?
Uncontrolled
diabetes.
Aha, emra wan hwe ho asem anka no. Den ne de beba honam dia no so. The complications or dangers of diabetes.
All right, so to continue our discussion on the complications of diabetes, it's important for me to state that this education is serving two purposes. First of all, if you don't have it, you become aware and then you do periodic monitoring of your blood sugar so that if you are getting what we call a pre-diabetes, we can put in the necessary intervention to ensure that you don't develop it. And two, if you have it, then you must become serious with your hospital or clinic attendance so that it could be managed very well to avoid the issues we are going to talk about. Now,
can I please take that before?
Yes,
thank you. Doctor say, Professor Ochinya Vinci to say, botaye nti a yehia de nyina ye botaye kese mienu pa edi kan eni se woni bia atwenwadwen abaso se se yare sei na tie na se mentumi kan kohwehwe me mogam ne me honamu na se okona woni bia wo ho fan na wo bi susu a yahwe aka ho asem ama etoso mienu ne se wa wo bi dada no fe kwampa ben na be fa so di atena se a enkonkofa ensunsuanso bone a afei na obebubo suyi akyere yen nti embotaye mienu na waka ho asem pa chebe ko ne obi.
All right. So when we look at diabetes study, we have organs in the body, we call them target organs.
Okay.
When we say target organs, we mean that they are organs that experience the bad effects of diabetes most.
Okay.
And we have the brain as a target organ. We have the heart as a target organ. We have the eyes as a target organ. We have the kidneys as a target organ. We even have the skin as a target organ. So
is that all, or there can be many?
So
I want to mention them.
So you can mention them.
Okay.
Then we will take them
one after the other.
The other. So the brain, the eyes, the heart,
the skin, the kidneys.
The kidneys, the skin.
All right.
And then you can mention the blood vessels. Actually, the effect on the blood vessels and the nerves would result in some other complications.
Okay.
Yes.
Yo, adofunum diabetes ye yare ko de awu se wa amwani ankoso a ene sen o se wa nhwe ama sichire ya adoso wo mojamu ankofo ma na se wa mpa hu dwuma ndi a ye wo honam na kwa bia brofo mo mfrɛ ne target organs odi n'ani siso yare ne di n'ani siso se ebesɛe no edi kan adwene no toso mienu akoma toso miensa wani a wo de hwade yi toso nan wo honam dua yi etoso num entini a wo ye honam mu no ye wo mienu ye wo ntini a moja na fam moja ni so na fam ne wo ntini a eye adwuma se no na mai obi di ne saka a obete ade atwa wa wote ye frɛ no nerves no enti o se enna wo saabo kidney se frɛ ne saabo de hyehyɛ ha na eye Johnson no eno nso so eye baabi a yare ne di nani kyerɛ saa nioma ya bobo nyina susu ni wa uwu anisa yo erade moa yen na yenko no ho na yenko di mu chemu na me ma wanya ne ntiye se enche yebema wa frɛ asimu obebobo nioma se kwan an efa so a saa target organs yi etimi di ninya are we okay to go with the line so that as we talk, or we should complete this one?
So let me quickly
complete this. Okay.
Complete, then we could open the line. So I mentioned that then probably could talk about them whilst we are listening from taking questions from our viewers. So the brain as a target organ, the effect. So diabetes can cause stroke.
Okay.
Yes. So when we talk about stroke is actually in the medical term called cerebrovascular accident.
CVA.
The cerebral has to do with the brain. Vascular has to do with the blood vessels in the brain. So the accident occurring, it could be either that the blood vessels have ruptured, and so there is hematoma, we call it cerebral hematoma, as a result of rupture of the blood vessels, which will impair blood supply to aspects of the brain tissues, which would we say die or degenerate, so will cause what do I call the symptoms of stroke. Or the blood vessels could be blocked. When it's blocked, then it prevents blood flow to the distal tissues to the blockage, and so also result in stroke. So diabetes actually can cause stroke. It's not only high blood pressure that causes stroke. So the brain as a target organ, the ultimate effect is stroke. Then the eyes.
What makes the
diabetes.
Sugar in the blood causes the rupture or the blockage?
I told you that the high blood sugar, it could affect the vessels. What happens is that the high blood sugar causes injury to what we call the endothelial lining. When you take the blood vessel, the inner linings, when they get injured, it's like when you get a cut, the blood decides to flow. There are clotting factors that arrest the bleeding.
Okay.
So when there's high sugar in the blood, it causes injury to the endothelial lining. And so the body tries to, the clotting factors try to heal that injury. Okay. And so that platelet aggregation as it builds up can occlude the blood vessels.
Okay.
And then result in stroke. In the brain, it will result in stroke. In other parts of the body, it has what it will cause.
I asked this question because when we're studying hypertension, we got to know the accumulation of fat tissues or fat accumulation or cholesterol in the vessel causes the blockade.
It's not only that.
So we wanted to clarify it for the viewer. I wanted to clarify it for the viewer to know that it's not only that one, but this one too. So this one is accumulation of white cells that or
so we call it
clotting factors. That
so if you have high cholesterol levels coupled with this one, it enhances the blockade. We call it thrombus formation.
Okay.
You get so it will either block it or it can dislodge. It can break off and then travel to a distal point and cause the blockage there, which will now bring about the dying of the tissues there, and then the medical condition that the resultant medical condition with respect to that part of the body.
All right,
Yes.
all right,
Yes.
all right, all right. Thank you very much. Thank you very much.
Okay.
As you're saying, we are not rushing it.
Yes.
The primary thing is to get to the understanding of the viewer,
Yes.
bringing the information to the doorstep of the viewer. Odofo a wo hwe yen apomudin mu nimdifo ya Dr. Reginald Amaye hunu se enye pressure nko a na se hypertension nko a na betimi ama wanya stroke se wo kae a mra yesua de fa hypertension ho no ye hunu se srade no keka bomu a si ho a etimi si droben a moja no famu na afi moja ne nkwadwene ni mu ana obetimi anya stroke na we nso de erade enam ne so ama ye hunu se esane saa esichire ni a ewo edoso moja nim nti me ka ne se etimi di ekro bi eba ntininim nti hunam na kwa bi epese nka omakro ni wu anka obema moja ni twa no aha na saa nioma na keka bom clotting factors no ekeka bom ane no so aboaboa no te se de nkasrade ne beboaboa no na esi kwan bio na fei emma moja ne nko te se de nkasrade ni mak moja ne nko na nti eba ne saa amana nkwa efa na nka wo se nya moja ne na ewuba ana se ade na nkasa aboa no susu wo srade nim no entini nim no ebitimi te etine namu a ekohye ba bia ho ye keto na akosi kwan wo ina che se eno no so sikwan ama wuntumi nya moja nko ba bia ewo se nka ewo ekwan na chi no na ama wanya stroke. Oh, I think that is enough because we have about 10 minutes to go. When kwa ya de kese e wo se ye hwe nuti na ma diabetes tinima obinya stroke no eti waka sisu se wo asichire yare na se wo san pressure ka ho na srade asikwan asichire yare mu moja we sensusu asikwan a ene na wa wo hwa eden na edebeba nuti na odofo THM TV afa atu ye hu so se ye de information ni beba ma hu se yare sei wo ho se wa anhwe na wani ankoso amaya amoso bra ubetime nya nsunsuanso bi se we target organs obubo osui adwene akoma ani we nyina de nyina we film abetimi atena se we yi film me kan yi bi film se we de nya hwe na we se betimi ato aso a sabo kidneys entini e ma wote se yatim yakao sa ntini no eni ntini amoja ne namu edi afusane ni nyina kekabom a hadwen ene ya fa adwene no nko a akabe 10 minutes penti pese ye de number no to so emra wonya frɛ ye no obeto aso akasa de enti ye numbers no ni 059 7724291 059 7724291 and answer 020 390 3749 020 390 3749 enti ye besrɛ say fresa number no na ebisa o question yesua de pa fiti last week ebesi na yesua de papa wayiyi nsem bi atoto ho a kaye ntene ba bia gise ha enti no wo asemisa bi ebisa wo comment bi so a inhire bi ana asemi so abetim de atoso na yesan ko back to doctor ho numbers ni bobio Mr. Producer Fanto so mame 0597724291 0597724291 and I say 02039033749 02039033749 friend numbers no bisa question can comment na yento aso yebeko openini hobio pacho betimi ato aso as we wait.
Yes, so I mentioned that the eye is also a target organ. So if you remember when we talked about the symptoms, we talked about blurred vision. All right. Diabetes will not just cause blurred vision. If you do not attend to it, it will actually cause blindness.
Wow.
It's one of the significant causes of blindness globally.
Wow.
Yes, because the high blood sugar, just like the way it causes injury to the endothelial linings of the blood vessels, this time it affects what we call the retina. The retina is what the organ in the eye that enables us to see. So diabetes is able to damage it.
Okay. Bebacho odofo be ni. E ka se Yesu mu nkwa na waje so se ehia pomuden. Yesu mu nkwa.
Ehia pomuden.
Bebacho yo bodin na e ka be bia okasa efri.
Dcns Mbacho ba Mary.
Bacho Mary okasa free.
Kasa free house in Ebuakwa.
Yo Mary nyante chini ana.
Me bachane.
Yo bacho yo eradi sha yetie o.
Eradi sha mu bebre pa ene de djumadi na isia de o mankasa. No abaya bi wo hono ma kakra bi a wo se wanya white. No ko hospital ni akọhwe ni e mani nduro no ko pharmacy no to nduro but ene adisiam na mehu se e wo se okọ checking sugar level no hu se bia se diabetes na wanya na eye ni saa anase bibi fofra koni bia ne ana no den otimi suni nara but then no adisiana me mehu se e wo se okọ checking eno so hwe e bia na eye no ntina ma entinin kontiera din shira mo bebre ba
amen radisha doctor on oko medical school na mi
Dr. Reginald
Dr. Reginald radisha o radisha catch up for no ko so hwe why e da se radisha you.
Yes, so diabetes affects the retina. It causes changes on the retina. So there are times people have gone to the eye clinic and the doctors have referred them to the clinician to attend to them because there's what we call diabetes retinopathy.
Hello.
Okay. Me pacho Yesu mu nkwa na waje sister ehia pomuden.
Ehia pomuden.
Pacho yo.
Me pacho me kasa fi kumase.
Odin dey say.
Me dey de nana.
Yo, yetie o.
Me pacho ensande gume na me po hospital o mo say infection. So mo ma me dra e kwa na asamba. Nti no o se me ko check me sugar na.
Yes, so I mentioned recurrent skin infection. So it is important. You should check your blood sugar and see if you have high blood sugar or diabetes. If they are able to manage it, you realize that the recurrent skin infections will stop.
What you say? And now they are two sort of four, and now I can say, it's say, and also your pointer, and I say, yeah, dear, say, wait me a bit of a session or mojamono doors on the Duntino. Co na yen show mojamu say a situation a woman in him. Na a treaty no son share. Na ye gidi say a beboa. But I programming a but I in an dear mo cane. Say ube hunu Nindiano now 2 anamo, now yari be a wohono. Radia buana watimi a year few mamo. Radin shout, Freunia, na onosu, and Frebi 0597724291, 0597724291, and I say 0203903749. Pacha Yonko.
Yes, so apart from the eyes as a target organ, so the eyes basically means that there could be blindness. So the blurriness of vision, if you don't attend to it and then get a resolve, especially if there is a presence of diabetes that's causing that, and then you don't know, and then you wait, the damage will continue, and it could lead to blindness. Then the heart. So the heart is also a target organ. So
can I please talk about the eye?
Yes.
Pacho, or say yakaya yesuya de efa say the signs and symptoms of diabetes, and I say you bet me actually say be a ways when you see yare no ye won say or say wo hwa de na wani so ayi as a bo esi ade na wo hwe no and I say wisi say Sony SONY and I say no bibi ne nam ho nti na amana say de abomu no emfa ho say wo de ba wani ma na wo de ko wachi na wo ka say sa no enso ho a bet me ma wani na fira kra wani na fira kra nti mpempi no nkrofo timi de wo mani ekọ hospital say mani mi huna de yi na wo ko du doctor o hwe ni ho a na wasa de o ma ba o mo no ho say omo hwe siche yare no ho asem fi se siche yare nso ebetumi ayesa san se ni oka se koso ewo entini ni mu na ema etimidi stroke ba no ne fa ekosi wo ani ni so no ani no entini e wo ma na sade e wo ma ema yedi hu na de no sade ni bi si wo mu a ne timi ma wade hu no so ye wisi no enu nti no hwe ni yie se wani no eyesa hwe ni yie na eko check wo pacho.
Yes, so when we come to the heart as a target organ, the same thing is happening. The heart itself is also supplied by blood vessels. And then the diabetes mellitus can affect those blood vessels that feed the heart itself and then cause what we call coronary artery diseases, but ultimately can cause heart failure. So diabetes can cause heart-related diseases and heart failure. So apart from that, we have the kidneys.
Right.
The diabetes causes what we call kidney nephropathy. Usually when we urinate, the kidneys eliminate waste products, certain waste products through the urine. And usually we don't expect to see certain nutrients in the urine, especially protein. When one develops diabetes, it damages the kidneys, and then the kidneys will begin to leak proteins, albumins. And when that is not picked early and fixed, it would develop into what we call kidney failure. So diabetes causes a condition called nephropathy, diabetes nephropathy, which ultimately can lead to kidney failure. It is this effect on the kidney which can cause hypertension.
All right.
So when we talk about diabetes causing hypertension,
that's the relation.
That is, yes, it attacks the kidneys. And when the kidney is attacked, then it affects, it actually results in hypertension. So diabetes can cause kidney failure.
I think we'll have to end it here on this, but we'll have to pick it again the next time to elaborate on that. Yes, because it comes as something that needs to be broken down. Yes. Our time is almost up, and we are very grateful for the knowledge you've given to us. And yes, that's myself and my viewers. We are very grateful for that. But I have to break the recent one down for my viewers. But the kind you say, it sounds like a command so one tini or money mojanintino. Sa in Chechema, I didn't mind say, si anything ma in tini ariano. Sa in tinia and ma a command mojano nyasa ariana. A bit him a commander jail, Juma yet to say. Heart diseases bia na sa komamu yare bia no ubetumi enya na afei nso ohuri ekọ fom kọ kan sabo ne wasem se sabo no nso ho asem no sa ntini ni mu adeyo na esichie no de ba no a ekoso wo mu no ene junso na eye na nka wo se nke yiyi bi firi mu no afei se yare ne ba esichie yare yi ba sabo ni mu a na afei enyiyi mu na afei ejai ma ne ba junso ni mu eno nso edidimu a timi de insem bebreba yemre naso eninti ye pese wo san hwe yembio next time ye beto aso afi ya asasemu ye kan ye obebubu mu obecheche mu na ye hu se kwan be so ena me siche yare mpoko fa hypertension so eba saa de no ya adesua kese ti ye si ha se ya ye behwe se emra ye benya next time no ye be san to aso bio Mapomuden dwumadie what THMTV so na wo hwe ye yemre no aso ye di instructor se ebe ma Apostle Moses de genu ametepe ne hokafo ni mpanifo nyina wo ma yakwanya betena ha ene adisuani kese Mapomuden adisuani kese Dr. Regina Macmillan, right?
Camillon.
You see, that's why I don't want to mention it. Camillon.
So Reginald is okay.
Me
Dr. Reginald.
I don't mention it. The Macmillan and the Camillon, it confuses me. Dr. Reginald, the principal medical officer. No, so a new medical center. And I say, Emina Hospital, no. Radiadom last week ni enei empo eko idi oni eko esua de radiation papa yadana say please you greet some viewers or some lovers.
Yes, so I think that my biggest greeting today will go to Apostle Moses Ametete and the family. God bless you for the great work you are doing. The grace of God continue to abound and then to move you from glory to glory. And God bless you, viewer, who has made time to watch and to get educated. God bless you.
Amen. Wachia Apostle Moses wasachia wonso a wo hwe no se radi show. Me nso so midin de osonfo ba Mary. Midin no eya me de che marketia ho. Woni ma de go tia midin yam de na me kire omu. Midin ya me de che marketia because asasi so ahimfie mpo. So bi esiesie ho ana obi ye akwa wa ahimfie ho na won ne prapra wa. Unse when they go out, omu bosti say me so fi ahimfie ho so na bia oyakwa oprapra ho but erade ahumobo e na meye onyankopon fikesie mu osomfo ba. Yes, I also serve in the house of God. I am privileged to have that opportunity. I'm choosing tina midino hey me de che market ya no osomfo ba Mary we can make kind sense of mama da na was me osomfo ba Mary erade adom e na me di dwumade hu chiame e hranka osmafo ene ne hokafo ne penifo national executives any executive ya na mentini modi ni baako ba be kan national executives na me kan executives na rade adom ye nyina yenimo any national presbytery nyina tutu ministry for ne wo me hwefo yi rade show papa mira asante so rade show JJP rade shamo Mapomuden dwumadi na wo hwe yi ipacho ye de abawie nyame boa next week.
Mama Kwaba, Eba of a J Heba Clinic. What a Putoja, a Bonton New Site, Carpenter Junction, and the funny at you for a mutimino. Maybe I know be pay me number no pay extra coin about hospital.